Hello guys, welcome to Dr. Science. So today we are going to talk about serous otitis media. First we will talk about the definition of serous otitis media. Otitis means inflammation and media means the middle ear cavity. So inflammation of the middle ear cavity. Now what is meant by serous? Serous means sterile or clear fluid. I hope you guys have heard the term purulent discharge. Purulent discharge. Now what is this purulent discharge? So whenever there is a bacterial infection, this bacteria will start producing a lot of pus. This type of discharge which is filled with pus is called as your purulent discharge, which is seen in bacterial infections. On the other hand, we have the serous discharge. Now what is this serous discharge? So serous discharge is nothing but pure fluid. It have clear sterile fluid inside of it. Now this type of discharge is called as your serous discharge, which is sterile or clear fluid. I hope you are comfortable with the terms here. Now let's talk what are the causes of serous otitis media. So here is your external auditory canal, the external pinna. This is your external auditory canal, and this is your tympanic membrane. Now the tympanic membrane is in close association with the middle ear. This is middle ear. Now the middle ear is connected to the nasopharynx through a tube. So this is the nasopharynx, and this nasopharynx and the middle ear are connected through a tube. This tube is called as your eustachian tube. Now what is the function of this eustachian tube? So normally the middle ear have the layer called as your mucosa layer, and this mucosa layer is producing a lot of mucus. So this mucus is going to get into the eustachian tube, and from the eustachian tube it will drain into the nasopharynx. Now imagine a condition where this eustachian tube is blocked. Conditions such as your nasopharyngeal carcinoma or adenoid hypertrophy can block this eustachian tube. So what will happen? In the middle ear, the mucus will start getting accumulated in the middle ear. Now this mucus which starts getting accumulated in the middle ear looks like a thick glue. Hence serous otitis media is also called as your glue ear. Okay, serous, or the other name of serous otitis media, let me clear this one. So the other name of serous otitis media is also glue ear. Okay, so what are the main clinical features in these patients? The clinical features in this patient. Serous otitis media can happen in two age groups. One is in children and other one is in adults. So whenever you think of children, it is mainly due to adenoid hypertrophy, and not only that, it is usually bilateral. Now what is this adenoid hypertrophy? So this is the nasopharynx, and here are your eustachian tube. Now beside this eustachian tube we have adenoids. Okay, and whenever these adenoids are hypertrophied, they can block the eustachian tube. So adenoid hypertrophy is always bilateral, which is commonly seen in children. Whereas in case of adults, it is mainly due to nasopharyngeal carcinoma and this one is usually bilateral. Once again, here is your nasopharynx, and here are your eustachian tubes. So if there is any cancer in the nasopharynx, obviously it will be unilateral. Hence, nasopharyngeal carcinomas are, there will be unilateral eustachian tube blockage. Okay. And the second important thing is there will be serous discharge in both of this patient. Okay. Not only that, sometimes these people can have conductive hearing loss, and there will be adenoid phases in these people. Now what are these adenoid phases? Now imagine the eustachian tube is getting blocked, right? So obviously they want to suck in air. So what they will do, they will open their mouth to suck the air into the nasopharynx. So eventually long-term or chronic mouth breathers can have fluffy faces or monkey-like faces, which are called as your adenoid faces. I hope you are clear with the term. So those are the clinical features of these patients. Now let's talk about the ear examination. How it will look when you do a ear examination. So this is the tympanic membrane. In the tympanic membrane, sometimes you can see there will be retraction of tympanic membrane on ear examination. So this will lead to cholesteatoma. Okay, this will lead to cholesteatoma formation. I already talked about cholesteatoma in my previous video. So serous otitis media chronically can lead to cholesteatoma. So please watch it and come here. So there will be retraction of tympanic membrane, and not only that, you can see a lot of air bubbles in these patients. Okay, so those are the findings that you will see in ear examination. Now we will move to the treatment part, which is very, very important. In the treatment part, we usually do myringotomy plus grommet insertion. Now what is this? Myringotomy is nothing but whenever we cut open the tympanic membrane, it is called as your myringotomy. So once again, here is the tympanic membrane. What we do is we will cut the tympanic membrane, and after cutting the tympanic membrane, cutting of tympanic membrane is called as your myringotomy. After cutting the tympanic membrane, we will place a tube inside it to supply the air. We will place a tube inside of it. This tube is nothing but your grommet. Okay, so usually after we cut the tympanic membrane, which is myringotomy, we will place a tube inside of it, which is known as your grommet tube. Hence it is called as your grommet insertion. Now where we are going to put the grommet tube? So this is the tympanic membrane. This tympanic membrane is divided into 4 quadrants. Here is the anterior and here is the posterior. In the posterior, this is posterior superior and this is posterior inferior, and in the anterior it is the anterior superior and anterior inferior. So usually we will put the grommet in the anterior inferior part. The myringotomy and grommet insertion is done in the anterior inferior part. So that was about serous otitis media. Hope you guys like it. Thank you guys.